And thank Congressman Sessions for inviting me to participate with his town hall. This is my fourth one that I've had, and I'm willing to have many more. I want to thank all the organizers and the persons who put it together. Today we are here to talk about health care. I have years of experience in this issue. I'm a registered nurse and have 15 years of on-hand patient experience. I served as the inaugural leader for the psychiatric service at the Veterans Administration Hospital. And I have long seen this healthcare system in degradation. Congressman Sessions and I are both aware of the unique challenges that our communities are facing. We have different ideas on the solutions, and I'm open to ideas. I'd like to speak first on the impact that rising costs and the uninsured have had on my district in downtown and southern Dallas, and great portions of Congressman Sessions' district. The three committees in the House of Representatives have finished their individual work on a reform bill. And of course, the next step then is to put it into the Rules Committee where we bring these together. And so I'm here to dialogue with you and to hear what you have to say, as well as clear many misconceptions that I've heard during this time of debate. There are two distinct issues to keep in mind. One is about the moral obligation to ensure universal access to health care, which will directly benefit millions of struggling families and make this a better society. The other, a more complicated and difficult discussion, is about the long-term problem of out-of-control health care cost, which is a looming crisis that cannot be ignored. The greater the numbers of people who are uninsured, the higher the health care costs for all of us. You may know that Texas has the highest uninsured rate in the nation. The recession has made things worse. Since people lose their jobs, they usually lose their insurance if they had any. In my district, 222,000 people are uninsured. To me, it is unacceptable that these people do not have access to coverage. And if they did, we would not be talking about this reform today. Texas is a land of extremes. Extreme wealth and extreme poverty. For example, Plano has one of the highest household incomes in the nation. In contrast, more than 20% of my district live in poverty. My constituents are falling through the cracks of a broken healthcare system. The disparities are severe. If we didn't have Parkland Hospital, I don't know what we'd do. Who are the uninsured? They are working people, families with income below 200% of the poverty level, Hispanics, young adults aged 19 to 34, and families in which the adults work either part-time or only part of the year. More than 9 million uninsured Texans are at risk of bankruptcy if they get sick. 9 million, and bankruptcy has a trickle-down effect on the rest of us. In fact, there were 690 bankruptcies in my district in 2008, caused primarily by healthcare costs and not covered by insurance. This is a problem that affects everyone. Whether you're insured or not, consider the skyrocketing cost of healthcare. Since 2000, health insurance premiums have grown 3 times faster than wage increases. Families with employer-sponsored health insurance spend an average of $3,354 per year on premiums. And the figure doesn't include deductibles, out-of-pocket costs for prescription drugs or services for which insurance companies deny coverage. We have the most expensive healthcare system in the world. We spend almost 50% more per person on health care than the next most costly nation, but we are no healthier for it. America deserves better. The increasing numbers of the uninsured and the resultant cost shifting means that Texas families pay an additional $1,800 in premium costs, and just due to uninsured, the individual insurance premiums in Texas are $630 higher as a result. We need a uniquely American solution that builds on the best of what works, to foster competition among insurance plans and provide patients with quality choices. America's Affordable Health Care Choices Act provides quality, affordable health care choices for all Americans and controls health care cost growth. If you have insurance through your employer, you can keep it. For those without insurance or unhappy with their current coverage, there will be a marketplace for individuals to comparison shop among private and public insurers. One of the many choices that will be available is a public health insurance option. It will be self-sustaining. There are many people who object to that, but if we didn't need it, we wouldn't be talking here today. This is for people who are not insured and will not be insured by our current rules. A new independent advisory committee with practicing providers and other healthcare experts chaired by the Surgeon General will recommend a benefit package based on standards set by the law. The benefit package will include preventive services with no copays, mental health services, oral health service, and vision for children, and caps on the amount of money a person or a family spends on covered services in a year. Individuals who make less than $43,000 a year will receive special subsidies to help them afford insurance. The bill will make improvements to Medicare. Preventive service will come with no copay. It will eventually fill the donut hole over time in the Part D drug program and will allow the government to negotiate prices for prescription drugs, which we are prohibited in doing now because of the bill that passed, and I think that was 2006, like other countries do. It will eliminate 21% cut in physician payment plans for 2011 and physician reimbursements on a sustainable path for the future. We'll also reward primary care, coordination, and efficiency, increasing payments for primary care services and encouraging training of primary care physicians. I feel strongly that if people are given some individual responsibility for their conditions and know what to do about it, that will automatically improve our health standards. And so what is it in for us or for you? Quality, stability, and security. No more discrimination for pre-existing conditions like diabetes, heart disease, or cancer. No drop in your coverage because you become sick. No more job or life decisions made based on loss of coverage. No need to change doctors or plans if you like the insurance you have. Reform means that never again will your family be at risk of financial catastrophe because of high medical costs. It means an end to systems where profits come before people and millions go without vital health care. I think that is something for which we all can agree. In closing, let me say, we all know that America's healthcare system is in dire need of repair. I believe that a transparent, competitive health insurance marketplace is the best way to lower prices for consumers, and that our country needs laws that create strong consumer protections for Americans who purchase health insurance. America's Affordable Health Choices Act of 2009 is a good bill, even though it's still in 3 sections. I have read all 3 of the sections, and we are working to make it better. We're listening. I have some recommendations already to take back from one of my town hall meetings recently. We need to end the campaign organized by a loose coalition of corporate-funded interest groups, lobbying firms, and conservative organizations that have spread untruths that government will take your insurance away. That's simply not true. The intensity of all the negative drama underscores how extremely important this issue is to all of us. That is clear to me And I hope that we can cut through the rumors, the misconceptions, the lies, and clear it up with facts. It is time to put America, the American public first, and again, thank you for hosting this today. I'll be happy to answer.
Thank you, Congresswoman Johnson. Congressman Sessions.
Cal, thank you so much. Cal, thank you so much, and I'm delighted to be here today.